All right, let's get started. Good evening, everyone. My name is Ansarul Anas, and I'm delighted to welcome you all to tonight's webinar, The Gratitude Effect, Fuel for Happiness and Healing. Thank you for taking out the time to join us. At the Center for Integrative Psychiatry, we believe in a holistic approach to mental health. Our mission is to empower individuals by blending traditional psychiatric treatments with innovative, evidence based therapies that address the mind, body, and spirit. Whether you're dealing with anxiety, depression, or seeking overall well being, our team is dedicated to supporting your journey towards healing. But tonight, we are focusing on the transformative power of gratitude. Research consistently shows that practicing gratitude can enhance mood, reduce stress, and foster resilience. It's a simple yet profound tool that can make a significant difference in our lives. I'm honored to introduce our esteemed speakers. Dr. Tahir Khwaja, our Chief Medical Officer at CIP. He is a triple board certified psychiatrist specializing in general, child, and adolescent and holistic psychiatry. With training in nutrition and Ayurvedic medicine, Dr. Khwaja integrates traditional psychiatric care with natural treatments tailored to each individual needs. Joining him is Dr. Mariya Farooqi, our clinical pharmacist specializing in functional psychiatry. Dr. Farooqi holds a Doctor of Pharmacy degree from the University of Rhode Island and a bachelor's degree in nutrition from Oxford, England. She is certified in functional medicine through the Institute of Functional Medicine and is passionate about bridging the gap between traditional and functional medicine. Together, they'll share insights on how gratitude can be a powerful catalyst for happiness and healing. Let's begin this journey together. Please join me in welcoming Dr. Khwaja and Dr. Farooqi. Over to you, Dr. K.
Good evening, everybody. Thank you, Ansar. It's an absolute pleasure to be here. Thank you for the applause. Um, it's an absolute pleasure to be here. Um, if we can go to the first slide, what we're going to be talking about is something that we've probably, for those of us who have a religious affiliation, we often hear the significant benefits of gratitude and gratefulness, right? There's a lot of sort of commandments or encouragement towards being grateful for the things that we have in life. And so, from a religious perspective, we've many of us have already heard much about that. But interestingly, when I talk about the benefits of gratitude from a scientific perspective, really even sort of separating it and not really, we've acknowledged that religion has a lot of that, but then talking about it from a medical and scientific and researched and evidence-based basis, we don't often hear about that. And so that's what Dr. Farooqi and I wanted to talk about today. So I've given this talk a couple of times, and so these two numbers on the screen have changed every single time I give this talk. So from 2015 till now, there are two numbers that I try to sort of tend to keep track of. Where is, or how many times is the word gratitude mentioned in literature? So whether that is like, Wired magazine talking about the benefits of gratitude, that would go in the second line. So any publication, right? Amongst the 879,000 publications. Or if it's like, Home and Garden magazine, or, on some blog or something else, or something or other, any sort of publication that mentions gratitude or gratefulness, there are, I actually, just before the webinar, I updated this number from 100,000 from 2015 to 879,000 from 2015 till now. which is I mean, I was shocked by that number, from 100,000 to 800, almost 900,000. So that's a significant change in the number of publications on gratitude. So what I'm conveying to you by that is that the world is talking about gratitude and gratefulness and being grateful and showing gratitude, but sometimes we don't really hear about that much, amongst psychiatric and mental health providers. We do, particularly in terms of gratitude journaling and so on, and we'll talk about that at the end. But the top number, the 2,500 or 2,550 peer review journals. So there's a website that is operated by the government, where they basically keep a repository of all, like, high quality peer reviewed journal articles. What does peer reviewed mean? That means that if I write an article and I just want to publish it on my blog, I don't need Dr. Mariya to read it for me. I can just publish whatever I want, and that would count in the bottom number, 879,000, because that's just a publication that anybody can publish. But if I want it to be considered peer reviewed, then I have to write the article, send it to, like, 2 or 3 or 10 or as many different peers as I want. So send it to Dr. Farooqi, Dr. Mariya, and I'm like, hey, Mariya, read this for me. Make sure that I didn't miss anything. Make sure that it kind of reads well. Make sure that I cited the citations properly, so on. And then I send it to 3 or 4 other peers who are at my stage in their careers or whatever it is, even if they're from a different discipline. So pharmacy, I could send it to PhDs in psychology or therapists and so on and so forth. And then those would be considered my peers for that particular subject. And then if they say, okay, this is a good article, Dr. Khwaja, you should go ahead and proceed with publishing, then I could submit it for publication. So you can see that it's a little bit more stringent. So this number I just updated from 2015 till now, from 1,200 articles to 2,550 articles. So that's double. That's double the number that. So there are a lot of articles and publications extolling the benefits, or talking about, or praising the benefits of gratitude and gratefulness in our lives and the benefits thereof. And so what we're going to do is we're going to take a few of those, maybe like 3 or 4 peer-reviewed articles. We're going to take 3 or 4 peer-reviewed articles, and then maybe one general publication, and talk about them generally. Like, there ain't going to be no quiz at the end of this that, okay, which publication, was it the Journal of Palliative Medicine? That, we're not going to do any quizzing, but it would be really good to kind of see what a couple of those are, just a smattering of those articles actually said about gratitude. And then we're going to take one of those articles and kind of dive a little bit deeper into that, and that'll be the last article that we review before I hand it over to Dr. Mariya. By the way, folks, if sometimes I might kind of ask like silly questions. If you don't have any noise in your background, feel free to leave your microphone on, so that this kind of feels like a little bit of a classroom, or kind of like a lecture hall where you can actually call out. Maybe if I make a dad joke or something, you can actually snicker at it, or whatever have you. So if you don't have any noise in your background, feel free to leave your microphone on. And if I ask a question, then we can kind of make it a little bit interactive. I might intend to ask a question that, hey, what do you think were the findings on such and such? And then you can potentially say something. All right. Can we go to the next slide, please? So, all right. Again, guys, don't be intimidated by what you see on the screen. Just kind of, follow along loosely. Just focus on what I'm saying about what's on the screen. I'll go over the whole thing, everything that's on, so you don't have to feel like you need to read it. All right. Now, the first of those publications that I found to be really interesting was what we call a meta-analysis. Now, what the heck is a meta-analysis? Meta-analysis. Oh, it seems like somebody's permission for microphone was denied. So if the moderator could just take a look at that. So a meta-analysis is where there have been a number of different peer-reviewed articles. Okay, so a number of peer-reviewed articles that somebody then goes and says, okay, now guess what, folks? We've got like 1,000 different articles on gratitude. Let's look at some of them and see what they all found. So then I'm going to take all 1,000 of them and then kind of run them through my own kind of microscope, right? And say, okay, there's 1,000 of them. Can I talk about all 1,000 of them, or do a smaller number of those 1,000 publications kind of speak to what I want to talk about? So then in this particular case, there may have been a good number, like a huge number of articles, but then 65 of those articles actually met the criteria that I wanted to talk, or that these authors wanted to talk about. So out of all the publications on gratitude, they took 65 of them. So that's 65 different publications, different articles. And when you bunch all of those together, it ended up being about 18,000 people, 18,000 participants, or 18,000 study subjects, right? That were surveyed, or that were interviewed, or that were tested, or whatever it is. 18,000, guys, is a huge number of participants. So in a lot of different studies, you might find like 10 people, 10 subjects in the study. Other articles you might find like 100. Like, wow, that's pretty. If you find 1,000, that's like a pretty significant article that was able to find some relationship in 1,000 people. This analysis, broad analysis, it essentially talks about 18,000 people, which is a earth-shattering number of people. So what were they evaluating? Does gratitude make you more social, pro-sociality? Does it make you a nicer person, essentially? Does being grateful make you a nicer person? So according to this journal, in the palliative, so end of life setting, palliative care, like folks who only have about 6 months of care, 6 months of life in the best estimate of their doctors remaining, they found that gratitude has a higher quality of life in the end of life setting, and then it has a better health outcome, and there is a better sense of sort of lower psychological distress in the end of life setting. And so they've found that not only in one article, they found that not only does it make you a nicer person. So I have some notes on the side that gratitude makes you more pleasant to be around, according to this meta-analysis, makes you more pleasant to be around. And people are more attracted to those who are more gracious, meaning who are more grateful, or or more kind of, we think of the word gracious as being more forgiving, or being more giving and forgiving, and letting somebody go first, or kind of holding the door open for somebody else, or somebody who's a little bit more gracious, and someone who is a little bit more grateful in their lives. And then the next article, where they found that in end of life settings, folks who were at the end of their end stages of their life had a higher quality, when they looked back at their lives, they felt like there was a greater sense of accomplishment, higher quality of life. They had better health, meaning, and we're going to talk about some of the physiological benefits of gratitude. So they were more healthy overall, even though they were in their end of life setting. And then they had lower psychological distress, according to this journal, which is a journal of palliative medicine. Can we go to the next slide? So another article, and this was published in Sage Journals in 2017, that the power of gratitude, the benefits of gratitude are that it has benefits in your social life. Being more grateful has benefits in your social life. It has benefits in your physical health, and it has benefits in your psychological well-being. Okay, so we can probably understand all of that. Okay, great. If a person is more grateful, grateful meaning that you're grateful to be, you're grateful to have all of your arms and legs, something that's a little cliche. You're grateful for all of your arms and legs. You're grateful for the gift of sight. You're grateful for the fact that you have children, even though they might drive you up a wall, but at least you've got children. There are so many others who don't have children. We just talked about end of life settings, people who have cancer. I'm grateful that I haven't had to deal with that, or other people who have had to deal with that but have overcome it. There's so much that we can be grateful for. So gratitude and having a positive, optimistic outlook on your life makes you more social. And we just talked about that in review article above, 65 different articles, 18,000 participants. That it makes you more social and more sociable, makes you physically healthier, and psychologically, it helps you feel a little bit more at peace. Isn't that what we're all looking for, right? That is exactly what we're all looking for, that for folks to feel like we're at peace. But some of the things that we don't know, or we may not have made the connection, is that having more gratitude and having a more optimistic outlook on life, which you can cultivate literally, and we'll talk about how to do that, gives you or helps you generate a stronger immune system. Did you know that, folks? That being more grateful not only makes you more social, more physical well-being, more psychological well-being, but it strengthens your immune system, which means that you get sick less. It lowers your blood pressure, which means that you get sick less. Right? Better immune system, lower blood pressure, lower anxiety, and lower depression. So you have improvements on anxiety. You feel less anxious because you've practiced gratitude. You've practiced optimism, less depression and less anxiety, which in totality, folks, what does that translate into? That translates into lower medication burden. And that's what the integrative means in the Center for Integrative Psychiatry, that Dr. Mariya Farooqi here is our functional provider, where she and I and our team are constantly looking for ways to help you without a medication. Okay, great. So that's that article, Sage Journals 2017. Okay, the benefits of gratitude: more social, more sociable, better physical health, better psychological health, stronger immune system, lower BP, lower anxiety, lower depression, essentially leading to lower medications in all senses of that word. Okay. Just looking at my notes here, if there's anything. Okay, so if there's anything that I left out, so this is directly from the article. Individuals who are grateful sleep better. I can't tell you how many folks I have to treat for sleep. They sleep better. Folks who are more optimistic and more grateful sleep better. They're more resilient in recovering from trauma, more resilient in recovering from a traumatic event, whether that is physical abuse, sexual trauma, sexual assault, military service. They are more resilient. Folks who are more grateful are more resilient in recovering from trauma. They convey more compassion to others and kindness, and they tend to take better care of themselves. This is directly from that article. Okay, next article. All right. And we'll also, so if folks have questions, please jot your questions down so that we can talk about it at the end. All right. So Journal of Health Psychology 2018. Gratitude and emotional intelligence. By a show of hands or an applause or something, how many of you have recently started hearing these buzzwords on emotional intelligence? Everybody, yes, everybody has heard about exactly. So many Ansar is giving a lot of thumbs up. So many people have heard about emotional intelligence. Now, emotional intelligence, what folks are saying now is that EQ and IQ, intelligence quotient and emotional intelligence or emotional quotient, are sort of two peas in a pod. So you can have a lot of IQ, but if you're not able to sort of relate to others, then you may have a little, you may be limited in being able to convey that IQ to somebody else, right? So then IQ, it requires EQ, emotional intelligence, to be able to convey that. So you might be super intelligent, but if you walk around as, I've got a 3,000 IQ. You can't have a 3,000 IQ. IQ is typically around 100, 110, around there. So, I've got a 200, I've got 150 IQ, whatever it is, and then you're walking around like that and ain't nobody listening to you, right? Because your EQ just isn't quite there. So you're not going to be able to connect with people to convey the IQ. So anyway, emotional intelligence is the ability to relate well to other people and then be sort of mature, and as we kind of grow and we experience certain setbacks, then our EQ matures with us with age. So gratitude and emotional intelligence. People who are grateful, this is directly from the article. People who are grateful have higher emotional intelligence, and therefore, right, parenthetically, I'm adding this, therefore have a higher ability to connect with other people, which goes back to the pro-sociability, that you're more likable. If you're more grateful, you're more likable. So people who are grateful have a higher emotional intelligence than those who are not grateful, right? People who are withholding and a little bit like, terse and guarded, it's a little challenging to be around somebody like that. But someone who is more grateful, even my hand movements are like open and less guarded. Like, people who are more grateful are more pleasant to be around. So they have a higher emotional intelligence, and they have a higher sense of well-being. So somebody who is comfortable in their own skin, in their own self, somebody who understands who they are, therefore is a little bit more calm, a little bit more settled, is able to relate to other people a little bit better. Okay. All right. So hopefully I'm not losing anybody. Can we go to the next slide? Okay. So, all right, guys. So now we've kind of, that was only like I think we only talked about 4 articles really, really quickly. This article I want to dive into because there are so many benefits to this article. All right. So we're gonna stay on this article for a little bit. And then right after this, I'll hand it over to Dr. Mariya. All right. So this article published in Psychotherapy Research 2018. Okay. The journal name is called Psychotherapy Research. It was published in 2018. The author is Joel Wong. All right. The title of the article, just like it says on the screen, is How Gratitude Changes You and Your Brain. Okay. So what did these guys do? These guys basically took 300 random people, and they broke those 300 people into 3 groups. Logically, 100, 100, 100. Okay? Don't worry about what the groups are before we go to that. So 300 people who were just about to enter therapy, like psychotherapy. They're like, okay, all right, hold on a second. Before you jump into therapy, we want you to do the therapy, but we just want to add one little thing that you're going to do in addition to the normal therapy that you're going to do. What did they add? For group one, don't worry about which group was whatever. For one of those groups, they said, okay, for you 100 people, we want you to write something that you're grateful for. And essentially, all of these groups only had to write 3 like letters, or they just had to write 3 episodes. Like, you know, they kind of wrote it like a gratitude letter. And they addressed it to somebody, but then they didn't send it. Okay? So that's another little important piece. They wrote a gratitude letter, but they didn't send it. They actually tossed it, or they kept it, or whatever. Anyway, they didn't send it to the individual, or if they had addressed it to somebody. So group one, they wrote exclusively things that they were grateful for. And they wrote how many times? 3. That's it. Okay, so week 1, week 2, week 3, and then that was it. That was the whole study. And then they kind of followed these people for, like, I don't know, 12 weeks or maybe even longer. I think they may have even followed them even longer, like a year, if I'm not mistaken. Okay, anyhow, we'll get to that. Group 2, you know how sometimes your therapist will say, okay, listen, I want you to write, but I want you to get stuff off your chest, off your shoulders. So write the things that you're feeling, right? So kind of getting all of your negative emotions out. Okay, so they're like, okay, this is what therapists ask their patients to do, so let's test it. And then group 3 was just like, hey man, just write what's on your mind, whatever, random writing, and each one of them got therapy. Okay, so which group do you think did the best? If anyone wants to say group 1, group 2, group 3, feel free to unmute and call it out.
Group 1, the gratitude group.
How'd you ever guess? This must be a seminar on gratitude. Yeah, yes. Can we go to the next slide? Okay, so group 1 did the best. Okay, so don't worry about, guys, don't forget, I'm going to read to you like a bedtime story. I'll read to you what's on the slide. I just want you to pay attention to me. All right. Group 1 did the best. Not only, guys, did they do the best, they did significantly better than the other group, then the get stuff off your chest group, and then the, hey, just write whatever comes to mind sort of group. Okay, the folks who are asked to focus on writing stuff that you're grateful for, they did the best. Okay, so the idea was to focus on what they were grateful for. So they showed a significant improvement, a significant improvement over the other 2 groups, significantly lower depression and anxiety. This is amazing, guys. This is not, I'm not talking about, you know, sort of, yes, we've got what we mentioned at the beginning, that there's the religious benefits, of course, of gratitude. Yes, but we're not even talking about that. We're just talking about the scientific literature. This is like evidence-based, you know, peer-reviewed journal articles and so on. They had significantly lower depression and anxiety. And writing letters, even when unsent, was therapeutic. Writing, the actual act of writing, was therapeutic in and of itself. So the benefits appeared. So how many times did they write? Do you remember how many letters they wrote? Anybody? Going once?
3.
3. They wrote 3 letters. Okay. So week 1, week 2, week 3. And then they didn't write a 4th letter. The benefits started appearing in week 4. Okay. So in week 4, they started noticing that they started, well, okay, I believe that this benefit that I'm about to say started earlier, that they started seeking out gratitude opportunities because they knew that they had to focus on gratitude. So then they would start to seek out additional gratitude opportunities right away. But then the benefits of lower depression and anxiety, they started noticing in week 4. Okay, which is really quick. Okay, it's quicker than an antidepressant, mind you. We prescribe antidepressants all day long. All right, it was most effective. Okay, guys, I want you to pay attention to this last bullet point. The gratitude journaling or gratitude writing was most effective when they avoided writing negative words. It was most effective when they avoided writing negativity, when they avoided pessimism, meaning they focused and they, sort of encouraged themselves into optimism. Then it helped to change their mindset. Can we see what's on the next slide, please? Okay, so the long-term benefits of this writing. So gratitude led to more lasting pro-social behavior in this same article. I'm not referring to a different article. So we already saw 2 different articles that talked about pro-sociality, or meaning you're just a nicer person. You're just better to be around, right? And then this article again found the same thing, that the gratitude writing led to a long-lasting pro-social behavior. People who practice gratitude gave more in charity, according to this article. People who were practiced and wrote gratitude gave more in charity because they were more optimistic minded. They were more what's the word? Abundance mindsets. That's rather than constricted, or what's the opposite of that, right? Constricted mindset. So somebody who practices gratitude feels like, I've got, and I can share, and the benefits of that kept on going through 3 months later after the study ended. And in the brain scans that they did, found that the area where depression lives, the dorsolateral prefrontal cortex, or in this case, the medial prefrontal cortex, the prefrontal cortex in general, had increased activity. And that is one of the areas where, sort of in a larger scale, in the prefrontal cortex, that's where depression lives. And so they found higher activity. It's kind of like if you know me as a physician, the TMS that we offer here, it helps to stimulate the prefrontal cortex where depression lives, and then there's more activity, which reduces depression. And then the suggestion in this article was that long-term neurological benefits with even simple expressions of gratitude reshape the brain into positive. So just simply writing that I'm grateful for and why. I'm grateful for and the reason why. And not just saying, oh, I'm grateful for my children, or I'm grateful for my wife or my husband or my whatever. I'm grateful that I have a job. I'm grateful, whatever. But writing a little bit more specifically that, I'm grateful for my child who just brought me water, or or whatever, or my such and such, who my friend who called to check up on. Oh, I'm so grateful for Jenny because she she called to check up on me, or I'm grateful for something specific, a little bit more specific than just sort of these large brushstrokes. And then sort of writing, not just writing the same thing every single time, but encouraging yourself to identify other things that you're grateful for. Maybe you try to avoid rewriting the same thing that you wrote yesterday, or earlier this week, or whatever it is, unless, of course, if there's something really significant that actually happened. Can we see the next slide, please? Okay, and so here I will bow out and allow Dr. Mariya to take the stage. Thank you, folks.
Thank you, Dr. Khwaja, for such a lively presentation. Can I tell you what I'm grateful for?
Please do.
Yes, I'm grateful for being part of a team with Center for Integrative Psychiatry, where I can talk more than just medications, right? I can talk about other holistic approaches that we have in our toolkit and that we can share so eagerly to help manage our mental health conditions that we are seeing today in our community, right? Just because I'm a pharmacist, it doesn't mean I advocate for medications always. I would like us to explore what other things we have yet to still explore and utilize in our toolkit before we go on to medications. Because of course we live in America, right? Or North America, and we have a medication for every ailment, right? So you're a doctor. If I tell you I have some issue, you know a prescription you can write for, but it doesn't mean that's the best solution for us, right? So thank you for that.
And we're grateful to have you, Dr. Farooqi, and the whole team at CIB. Wonderful.
Yes, thank you. Thank you. So I am going to throw more studies, and I will be just very brief. There was this landmark study by Emmons and McCullough, and this was a study that was so basic and it's so practical for us that we can do. We had to, in this study, the participants were asked to journal 5 things only once a week for 10 weeks. So choose a day of the week, say they chose Sunday, write 5 things, no big sentences, just 5 things you're grateful for, and put that paper away. And they had to do for 10 weeks, and that was it. Okay. And then they were given this assessment scores, some tools. And what they found that people who were able to journal compared to people who were just asked to write neutral things, just write like, I went to the shops, I played with my son, I played piano, right? These are neutral things. Instead of saying like, I played piano and I found myself really improving in my skills, something like that. So people who practiced gratitude and who wrote 5 positive things, what they were grateful for in their journal, had greater life satisfaction. For me, this was significant. Better sleep and fewer physical complaints like headaches and pain. What does that mean to me as a pharmacist? That we are reaching out less to medications like ibuprofen and Tylenol, which are great and available over the counter, but they do have significant side effects if we use them too many times chronically. Okay. And as a pharmacist, I see this often, that patients who cultivate gratitude have this habit of like expressing gratitude, tend to be more hopeful in the treatment plan we offer to them, and they're better engaged with our team and with their care plan. So it makes me happier to see when a patient who is like, yes, I did have problem with sleeping, but I'm sleeping for 5 hours straight at night. To me, 5 hours is still something you can work on, but the fact that they are still grateful for the 5 hours of sleep makes me more hopeful for their treatment. Next slide. Okay, thank you. Okay, now there was another review that looked at how our gratitude, our outlook of optimism, and our emotional resilience affects our heart health. And then, as we know, cardiovascular disease is on the rise and always has been. Now, this study used various validated self-report instruments, and the findings were super clear. People with higher levels of positive emotions had better cholesterol levels. Mind you, they may have cut out their like carbs or sugar, but the fact that higher levels of positive emotion dictated the cholesterol levels as well as lower blood pressure, right? So say something you didn't like and you got upset, and then you started you felt the anger stemming in you, and you felt like, the blood rushing to your head. Have you ever had that feeling when you're like supremely angry? Okay. But they shifted their focus to something that they were grateful for. Okay, yes, I'm angry at my son for making a mess, but I am grateful that I have children, right? What that mindset shifting does, it lowers our blood pressure. And when the blood pressure is lowered, what does that mean? We're less likely to be medicated. Our medication doses tend to get lowered, Okay. If we have better cholesterol, that means we don't have to be on statin forever. Now, this leads to this shifting to positive emotion leads to better adherence to medication and lifestyle changes, right? So we do see people who at our clinic who sometimes, non-compliant. And I asked myself, what emotional barriers are getting in that way? How can I have a discussion with them that is making them think that this medication therapy or treatment plan is not conducive for them? What is the emotions that are getting? And usually I find it's like, I don't know how it's going to help me. Okay, that's what they may say. I don't know how it's going to help me. So when I shift their thinking, the mindset to, acknowledging the things that are working well for them, then it allows the mindset to be created that my body is worth caring for. And I want us all to understand and appreciate that when we take care of ourselves, when we believe we are worth taking care of, okay, it allows better health outcomes. Next point. Next slide, sorry. Okay. Yes. Are we on the next slide? Yes, yeah, sorry. Okay. Now, gratitude, the work of gratitude literally, as Dr. K alluded to earlier on, reshapes the neuronal network in our brain. And that causes a long-term change. So there was a functional MRI study. So for people who constantly practiced gratitude, generally for 3 weeks, so they saw an increased activity, just like Dr. K said, in the prefrontal cortex, in the area where it's responsible for executive high-level decision-making. And what they found that people who did gratitude journaling for 3 weeks, the benefit, the neuronal activity persisted for 3 months after, 12 weeks after, even when participants were not actively journaling. So that suggests gratitude creates lasting shifts in how we evaluate and respond to life. And to me, as a pharmacist, that translates into better follow through. Patients are more likely to make healthy choices, take their medications, or engage in therapy, which we offer at the center, not because I told them to or Dr. K told them to, because they're internally motivated. So again, gratitude strengthens the part of the brain that says, this matter, I matter, my body matters, and let's do it again. Thank you. So next slide. I'll hand it over to Dr. K, who will summarize.
Okay, well, thank you so much, Dr. Farooqi. So this has been and just a very sort of high level smattering of a few journal articles that show the benefits of gratitude. Remember the very first slide that I showed, we've basically only taken, I think I took 5 articles, Dr. Farooqi took 3 articles. So this math is a little challenging for me here, but I think that amounts to about 8. So correct me if I'm wrong. But so 8 articles, and what I said was, how many, do you remember how many articles there were? How many peer-reviewed articles were there? Who remembers that number?
I think
800,000.
800,000 were the total number of publications.
It was
And
2,550.
2,550. Allison, that's spot on. Excellent job, Allison. Yes. So we took 8, guys. We took 8 articles out of how many? 2,500 articles on gratitude. So there's, so there's something that the scientific community is telling us about gratitude. So science points to the healing effects of gratitude that, as Dr. Farooqi and I both said, reduces anxiety. Guys, we've got to stop with the benzos, please, or we've got to reduce the benzos by doing something else. Because just getting your refill of Xanax And I know that Xanax, I'm probably stepping on thin ice here with some folks. It's like, bro, don't talk about my, but really there's got to be something more. Because essentially, if you look at Xanax and Klonopin and Valium and all, Ativan, these are essentially alcohol in pill form. They have the same depressant effect, the same addictive qualities, the same withdrawal, the same seizure potential in withdrawal, the same DTs, and delirium, the same thing as alcohol. So our goal is always to try and get people off of these addictive medications. So there's got to be something else out there available for any folks who are sort of stuck in this cycle of, hey, I need my Xanax or I need my Klonopin or whatever it is. So gratitude journaling or gratitude writing helps reduce anxiety, helps reduce sadness and depression. Again, what we've actually talked about is writing and acknowledging our internal hopeful or developing our internal sense of gratitude. But we also want to talk about the act of gratitude, right? There are different ways of actually enacting gratitude. And that's by being a little bit more welcoming or being a little bit more, like I said, holding doors for people, as long as folks don't get too offended by that. Not that we're belittling anybody, but just because I don't want you to have to go through the trouble of opening a door that I already opened, right? And so if I'm, helping myself through, then I'm going to help you through, or carrying groceries for, someone who's elderly, or helping somebody, those memes on not the memes, but the Instagram posts or whatever, where it says that, oh, this has restored my faith in humanity, right? Those nice, wonderful, beautiful acts of acts of gratitude, where you feel super, calm and comfortable in yourself to be able to help somebody else. It actually changes the molecular basis of your entire body. It strengthens your immune system, lowers your blood pressure, strengthens, your brain in such a way that you have less depression and less anxiety and so on. And this is something, guys, that, just like these study participants wrote 3 letters, that was literally, guys, it was 1 letter per week. The studies show, can we go to the next slide? The studies show that in gratitude journaling, that you can do it every day. It would ideally be something that you do every day, but the studies show that even if you did it, 3 times a week, and you wrote something positive, something, to the exclusion of the negative and the drawback and the pessimism, to the exclusion of the negative, you wrote things that were optimistic. And you write 5 or 6 points, and try and force yourself to at least write 5 things that you're grateful for, what you're grateful for, a little bit more specifically than just, I'm grateful for the world. Yes, no, that's not good enough, right? What in the world are you grateful for? Are you grateful for the blue bonnets that this is what a patient of ours said, actually, after she got TMS. I would just ask her, how are you doing? And she's like, how am I doing? Wow, actually, now that you asked me, Dr. K, for the first time in a decade, I noticed that there are blue bonnets, little blue flowers on the sides of the highway. Guys, we see this every single day. We see those blue bonnets every day, walking through this garden or forest path. So beautiful. I would love to be walking. I'd be like, oh my God, I'm so grateful for the fresh air. I'm so grateful for being able to just run my fingers through these, as long as you don't have allergy, but running my fingers through the plants and the flowers and just smelling I'm so grateful for the clean air, something so simple, and then you write why. I'm grateful for the clean air because I feel like it's refreshing my spirit or my soul. Or I'm grateful for this friend of mine, Jenny, or my sister or my brother who called to check up on me, right? I'm grateful for my brother who I just got off the phone with because he called to check up on me. How amazing was that, right? Number two, I'm grateful for something else, okay? I'm grateful for Dr. Mariya Farooqi because she got me off some medicine, whatever it is, it doesn't matter. So say, gratitude journaling, that you're writing it down, you can say things to yourself in the mirror. The first thought that came to my mind was, how many of you, by a show of applause or whatever, how many of you remember Saturday Night Live? What is that? Affirmations by Jack Handy or something like that. And now something like brief thoughts or good thoughts or whatever. Anyway, by Jack Handy. Maybe it's just me. It's the white hair. It's the white hair, folks. Okay, fine. You'll have to excuse me on that one. But so there was and now deep thoughts. So go look this up. This is so funny. Deep Thoughts by Jack Handy. Deep Thoughts by Jack Handy. Saturday Night Live. This is a guy who sits in front of a mirror and he kind of reaffirms to himself, but the reaffirmations are super funny. Anyway, so you can say things to yourself that in the mirror that you guys go ahead and say that you are a good-looking individual in the mirror to yourself, and then say it enough that you start believing it. I know you guys are like, man, what? I thought this guy was a psychiatrist, but he seems like some snake oil hocus pocus person. But I'm telling you, folks, this is what Dr. Farooqi and I just talked about. We took a smattering of 8 articles out of 2,500, out of 800,000 publications. If you speak to yourself, then you will actualize what you speak, right? And then combining gratitude with action, and then gratitude with each breath. Dr. Farooqi, did you want to jump in on the previous slide or on this slide in anything that you may have wanted to convey as well?
No, I think you've covered everything. I'm okay.
So, folks,
I was hoping you get them. If there are any questions, people will be able to answer. Then we have a few questions.
yes, okay, please. So let me stop talking because I'm a psychiatrist, for crying out loud.
So we have a question. Will you be able to do another such session soon? We can consider. Yes.
Yeah, no, absolutely. I love doing these sessions. So we would. Is there? So if the author of that question maybe has an idea of what topic or subjects or a list of subject matter that might be appealing, we would love to kind of take some of that.
The other question is, does depression or antidepressants cause inflammation at molecular level? Yes, there is a theory that depression is caused by neuroinflammation. Neuroinflammation can contribute to depression because there are inflammatory proteins that are evident, that are seen in the in the brain cavity. Sorry, my face out. Is there another question? This is a long question. Oh, okay, sorry. We have another question. Can you talk about mood swings and mental health related to menopause? That's a topic we can have for another webinar. That's a very big topic.
Yeah, mood swings and mental health related to menopause. Yeah. So those are actually 2 separate topics.
Yes.
Mood swings, getting towards like bipolar disorder, and what are non-pharmacological interventions that you can use for that. And then Dr. Farooqi actually is the expert. One of her specializations in her functional medicine and integrative and holistic treatment is about women's health and menopausal issues and hormonal rebalancing. So if anybody is interested in finding out about that, Dr. Farooqi is the resource for that.
Can you send the articles? Do you have any recommendations for books about gratitude? Do you have any recommendations for books about gratitude?
We can certainly, Ansar, are we able to send the journal article? Maybe even we could send links.
We
to
can
the-
email it after this.
Okay, that sounds good. We could do that. Now, in terms of books, I don't necessarily know of any books off the top of my head, Dr. Farooqi, if you might be able to help with that answer. You're on mute.
There's some great books I've read, but I can't think of the top of my head, but I will share some, and you can email them out, right, Ansar, with our emails? Yeah, so a suggestion for books. I have some in my library. You can talk, I can
Or if
share with.
anybody else knows, if anyone else has any suggestions for books, feel free to jump in. You know, particularly talking about gratitude and the benefits of gratitude.
Next question, how to concentrate on being grateful with a short attention span, ADHD. Sometimes during prayer and during life, I try hard to focus on positivity, but my mind trails off to random things.
Amazing question.
Do you want to answer that?
May I? So there are a number of different exercises that we can do to help with focus. I don't want to sort of shift over into focus and attention. But one of the things that we learn when we're studying is that the more senses you use when you're sort of studying, meaning you're writing, you're kind of reading, and you're so when you're writing, you're using the sense of touch. When you're reading, you're using the sense of vision, right? And then maybe as you're writing, you're kind of speaking. So you're using 2 or 3 different senses when you're studying. Now, when you're writing, and that's why I think this was a question from Sister Zainab. So when you're writing, and then you're even speaking that thing that the text that you're writing, that helps you refocus, and that really helps rivet the attention. That's one thing that you can do. The other thing you can do is you can stand up when you're writing. You know how when you're falling asleep or when you're getting distracted, you might stand up and go to the back of the classroom and just sort of pay attention. Then the professor knows that, okay, you know, homegirl must be feeling a little tired, so that's fine. That's why she stood up and went to the back of the class. So there are actual physical changes of environment that you can do. You could sit at the park if there's a park nearby. Go sit outside. Go, you know, sit on a bench or something like that. Get some fresh air. Get some sunlight, and then write your gratitude journaling. The other thing that you can do is you can look into the science of mindfulness meditation. Mindfulness meditation is a particular type of meditation that helps with prayer. That, you know, the goal of mindfulness and the goal of focus in your prayer in the here and the now and the present are exactly the same for the meditation and the prayer. So this goes to all types of prayer, you know, all religious backgrounds. When you're praying, especially when you're praying in a different language, that speaks to Muslims and folks of the Jewish tradition, where we're speaking different languages. Maybe you don't have that much of a command of the original language, but so then when you're practicing mindfulness, that is the same exercise that we're encouraged to have when we're in our prayers. So then those would be things: change your environment, stand up, use more senses, actually write things down, and then mindfulness meditation should be very helpful for you and your prayers. Inshallah.
Awesome. Thank you so much, Dr. K, for answering that question. Thank you everyone for participating. We'll be sharing the recording of this webinar along with the resources we promised shortly, hopefully tomorrow. And please keep an eye out on your inbox whenever we are doing events like these. We'll email you with the RSVP link. That will be all for today. I hope you guys have a very productive week. Thank you so much for joining.
And
Thank
sorry.
you.